Going into summertime, I mean, I know my first surgery, top surgery was in, I think, late May, early June. And I live near the beach and grew up near the beach. I mean, I during my first top surgery, I actually had tan lines in general,
Yeah,
uh,
I remember.
from a bathing suit. So that was pretty interesting the way that looked. But so, and also because of that, I knew, like, going into summer, I was so excited to now, kind of feel great in my skin, and want to be outside and with my shirt off. I mean, can we speak a little bit to, like, how the sun really affects scars, and how important it is, especially this summer, to really kind of keep those scars out
Yeah.
of
That new skin that's forming over that skin bridge of any scar on your body, it's baby skin. It's fresh, brand new, very new skin, and it can be very damaged by the X-ray, the rays of the sun, basically the radiation from the sun. And you want to be super careful, especially that first summer after any surgery. And what does that mean? For most patients, I say, buy a rash guard with SPF in it. They do make some tapes that have SPF in it, but really you got to, and I have patients who come in with tan lines just around the scar. You have to be super careful. And in general, you want to be careful about sun exposure and skin cancer risks. But specifically for a scar, what we're trying to avoid is the body's natural response to sun exposure, which is the melanin gets activated and you get darkening. That's what a tan is all over your body. But if you get it within a fresh scar, the new skin of a scar, that can become permanent and it can tattoo the scar. And all of a sudden, the chances of your scar actually kind of fading diminish if you get that kind of sunburn or suntan too early in this fresh skin. So just being super careful with it. You would never put a baby out in direct sun without any suntan or lotion or an umbrella. Don't treat your scars like your baby. Take very good care of it. Be very careful with it that first summer after any surgery. Even if your surgery was in the winter, it still takes about a full year. So you want to be super careful with that. What are your recommendations for massaging scars? Great question. So we know that tension across a scar can cause problems in terms, not only acute problems early on where the scar or the incision can open up, and that's called a dehiscence, and that's a major problem that may even require more surgery. But once we get past that acute phase where you have tension on something, that's where we get the spread in a wider scar and sometimes a thicker scar. So we want to try to avoid that. And we avoid that with, how we do it technically when we're closing wounds, the things that we do to try to reduce tension across that, things we do externally, if we use different tapes or glues, and so in adding compression to it. And then finally, once the scar is knitted a little bit more, we really want to try to get the scar to soften. And that's where massage comes in. And I don't mean going to masseuse, and getting a full body massage. I'm talking, it's really simple. You get two fingers and you just kind of do little circle motions all along the scar, wherever it is. And that really helps soften some of the tissue underneath the skin. Whenever we cut into the body, especially for top surgery, but all sorts of surgeries, we're cutting through different layers. We're cutting through the epidermis, the outer layer that you see, the dermis, which is the layer right underneath that, and then the subcutaneous tissue, which is usually the fat directly below that before we get to the muscle. Within that realm of skin, there's something called lymphatics, which are little tiny channels that go through the skin and drain fluid from outside of the cells back towards the central system, collection system, so that you don't get too swollen. If you ever had a night out and you drank too much, or you had a big salty meal and you notice, like, hey, my hands are a little bit swollen or my feet are a little swollen, that's because you had more fluid in that area of your body than your body could resorb. And it takes a little while. Sometimes you have to wrap it up or you have to put your feet up, right? And so the idea here is that when we cut into that, we're transecting, we're cutting right through those lymphatics. They don't exist anymore. They have to find a new way to live and drain that area of the body. So massage actually helps kind of manually push the fluid that's building up in that region out and helps soften it. And it also helps retrain the brain that it's okay to touch your scars. A lot of people get scared to say, "Oh, don't touch it, leave it alone." It's and you don't want to do that. You want to retrain your brain that it's okay to touch that part of your body, that it's part of you. And maybe you can't feel it as well as you used to be able to, but it will come back with time. So it's super important. Usually I start that around 3 to 4 weeks after surgery and tell them to do it every night, usually with a little bit of lotion or something like that, just along the scars itself. There's something bigger out there called lymphatic massage that really tries to push that fluid back to that central collection system. It's not really that required for smaller surgeries. There are other types of problems that people have that could require those things, but really it's just massage, and it's all about consistency, about doing this every day, for that early post-op period for those first 3 to 4 months after surgery.
Guacha stones help too, actually. So these use some moisturizer, and it can help with if your hands get tired from massaging. I mean, the top scission and surgeries are pretty long, lengthy scars. So guacha stones help with the massage process.